Many people come to me with complaints of lower back pain that just won't go. They've done x-rays, MRIs, taken medicines, done massages, and still the pain keeps coming back. And in many of those cases, it's not actually the spine that's the problem. It's something that's called sacroiliac joint or simply the SI joint. The small joint sits deep in your pelvis, connecting your spine to your hip bones, and when it becomes irritated or inflamed, it can cause pain that feels very similar to a disc problem or a sciatica. That's why it often gets misdiagnosed or ignored for months. Hi, I'm Dr. Jayesh Bhanushali, and in today's video, we'll talk about what exactly this SI joint is, why it starts hurting, some common myths people believe about it, and few simple exercises you can do at home to find relief. So let's start from the beginning. The sacroiliac joint is like a shock absorber between your spine and the legs. It doesn't move much, but it plays an important role in keeping your body stable when you walk, stand or bend. Now if this joint gets too tight or too loose or inflamed because of some imbalance, it starts sending pain signals. Most people describe it as deep ache in the lower back, sometimes radiating down the buttocks or the side of the thigh. Sometimes it's due to an uneven posture, like when one leg carries more weight than the other. In women, pregnancy is a big factor because hormones make the pelvic ligaments more flexible, and that can slightly disturb the stability of the SI joint. Arthritis, wear and tear can also irritate it, especially as we age. And then of course, injuries, lifting heavy weights or sudden twist can also trigger an inflammatory response. Even simple habits like sitting too long, driving for hours, having a weak core can quietly put strain on the joint over time. Now let's clear a few myths that I often hear in the clinic. The first one, many people believe that all lower back pain comes from the spine. That's actually not true. Studies show that nearly 1 in 3 cases of lower back pain is actually due to the SI joint. The second myth, that resting will cure it. In reality, lying down for hours only makes stiffness worse. Gentle movements, strengthening exercises, these actually help you recover faster. And the third myth is that if your pain radiates to the leg, it must be sciatica, which not always is. SI joint pain can also radiate it down the thigh, but it usually doesn't travel below the knee like sciatica does. So what can you do about it? Once you've been diagnosed properly, you have to remember that movement is the key. There are few simple exercises that really help stabilize and release the joint. One is the knee to the chest stretch. Just lie down, bring one knee towards your chest, hold it for a few seconds, switch sides. It relaxes both your lower back muscles. Another is glute bridge, where you lie on your back, bend your knees and lift your hips up. This strengthens the glutes, the core, which are essential for pelvic stability. You can also try gentle hip abduction using resistance bands or do the cat-cow stretch on all fours to keep your spine flexible. But remember, the goal is slow and controlled movement. Never push through sharp pain. If your pain doesn't improve in a few weeks or if it affects your walking or sleep, please consult your doctor or a physiotherapist. Sometimes targeted physio, posture correction or even guided SI joint injections might be needed for long-term relief. So to wrap it up, sacroiliac joint pain is common, but it's very much treatable. You just need the right diagnosis, consistent movement and good posture habits. So if you found this video helpful, don't forget to like, share and subscribe. And if you know someone struggling with unexplained lower back pain, share this with them. It might finally help them find the real cause.